Hello, my name's Emily and I'm just here to give you your discharge teaching. So first I'm going to go over some teaching for you and then I'll go over some teaching for your new baby. So first I wanted to talk about diet. You should have adequate nutrition since that's good for your body to heal. You need to eat foods that are high in fiber, and that includes bran, broccoli, cauliflower, and fruits, which will help your bowel movements become regular. You'll want to eat foods rich in calcium, and this includes dark green leafy vegetables, milk, and yogurt. Make sure to drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. In terms of activity, you'll want to gradually increase your daily activities until you're back to your normal routine. Make sure you rest frequently, and when you do have activity, try to avoid lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. And also, keep in mind that you shouldn't drive until you're released by your physician. For breast care, your breasts and nipples may have changed and are grown in size during your pregnancy. Wearing a well-fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. You can wear breast pads until your breasts stop leaking, and they make reusable ones as well as disposable. Leaking may occur for several weeks to months, and you may apply ice packs between feedings to ease any discomfort you might be feeling. If you're not breastfeeding, it is still important to wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples, and do not pump breast milk or permit the newborn to suckle to alleviate engorgement, as tempting as that may be. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time every hour as needed. To prevent tissue injury, please remember to not apply the cold directly to the bare skin, and do not massage or apply heat to the breasts. I have some tips for breastfeeding as well. Your baby's mouth should form a tight seal, and the lip should be against the areola and not the nipple. If the baby is suckling incorrectly, you can just slide a finger between your baby's lips and your breast to break the suction gently, and then you can just reposition and try again. If you're wondering how long you should nurse, it's as long as your baby wants, but that's usually around 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. But when this happens, it's important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing include hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, their little ears may even wiggle, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding, and you will feel a gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean that the baby is not positioned properly or that the tongue does not extend past the lower jaw. You can just remove the baby with the technique I showed you earlier and begin again. Please wash your hands frequently as you're caring for yourself to prevent infection, and always wipe front to back after going to the toilet, and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It is important you change your pad frequently. You may be concerned about some bleeding, but vaginal flow will decrease in amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. It's also important that you avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. And then you can also increase fluid and fiber in your diet with those foods I mentioned previously. You'll want to discuss birth control options with your healthcare provider, and you may choose to obtain a form of birth control before resuming sexual intercourse. Nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and you feel physically and emotionally ready. There are some warning signs I want to point out to you that you should report to your healthcare provider immediately if you notice them happening. So first is pain, redness, warmth, swelling, drainage, or a foul-smelling discharge from your incision or incision site, or if that begins to open, and that's if you had either a vaginal birth with tearing or a C-section. You'll want to notify the physician if you had any discharge from the vagina that has a bad odor, if you have a severe headache or blurred vision or visual changes, you notice a temperature over 100.4, or you're feeling cold or feverish and have chills. If you have any thoughts of harming yourself or your baby, you should notify the healthcare provider. A pain or burning sensation, redness, warmth, or swelling in the legs, and that could be one or both legs. If you have breasts that are painful, swollen, hot, tight, itchy, or have any sore spots with redness or red streaks and flu-like symptoms. If you're having any sharp pains in your abdomen, breasts, or chest, any trouble breathing, dizziness, or faintness, crying spells or mood swings that just feel out of control, if you're unable to empty your bladder or urinate and it's painful, difficult, or too frequent, or if you're having difficulty having a bowel movement. There's also a phone number in this packet for you to use if you'd like to report any domestic violence or abuse. It is 1-800-96 and then the word abuse. Next, I want to go over some infant discharge instructions just for your little one. First is safety. And so with sleeping, you'll want to place your infant on their back to sleep. Make sure you use sleep clothing such as a one-piece sleeper instead of a blanket. Don't let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should also not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area, and the baby should sleep in the same room as you, but not in the same bed. Avoid covering the baby's head for overheating. You'll want to keep that bulb syringe nearby the infant at all times to clear their throat or nose if necessary, and when it's time to clean it, you'll just clean it well with warm soapy water and allow it to air dry after each use. Before you handle your baby, you should wash your hands before and have all guests wash their hands before as well. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. For the home, something that I hadn't thought of until I started working here, but the use of outdoor announcements is not recommended to announce the birth because that does call attention to the presence of a new infant in the home. You'll want to question any unfamiliar person visiting your home or inquiring about your baby after discharge. Jacksonville is a very transient area, so we just want to make sure you and your baby remain safe at home. Don't use any home monitors or commercial devices marketed to reduce the risk of SIDS. In terms of behavior, crying is a normal response. It's very normal for your infant to cry. The most likely causes are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. To calm your baby, it could include feeding the baby, changing their diaper, gently rubbing their back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your baby. If you get frustrated or angry, simply put your infant in a safe place, take a break, and call a friend. Babies require a lot of sleep, and you should be waking your baby for at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tubby time, so make sure you are watching when they are on their tummy. This will strengthen their neck and abdomen. In terms of a newborn diet, if you're breastfeeding, the infant should be breastfed 8 to 10 times per day per infant cues. Be sure to hold your infant close to you while feeding, and your baby needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your baby upright over your shoulder while gently patting or rubbing his back to burp. And that should be done after each feeding. If you are formula feeding, if your baby is receiving Similac or Enfamil diet, and your baby sleeps longer than 4 to 5 hours and misses a feeding, make sure you wake them up to give them a feeding. Your baby will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Same thing, hold your baby close to you while feeding. Your infant needs to be cuddled, and never prop your baby's bottle to feed. And same thing as well in terms of burping. Infants need to be burped after every ½ ounce of formula. So after that, hold your infant upright over your shoulder while gently patting or rubbing their back to burp. Some characteristics to look for: your baby may have a rash. It's normal for your baby to develop a rash on their skin. It appears with very small red circular areas and a white dot in the middle. It doesn't require treatment and will generally resolve within the first week of life. You can avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially the nose, and they will also disappear within the first week of life. Jaundice is a common occurrence in newborn. Your baby may appear to have a yellow coloring to their skin. It'll start in the face and progress down to the toes. If you notice your baby appearing more yellow in the next 24 hours, you'll want to call the healthcare provider immediately. For bathing, your baby will need to be sponge bathed until the umbilical cord comes off. So use a soft washcloth and plain water and gently wash your baby's face. Bathe your baby from head to toe, saving the diaper area for last. A mild infant type soap may be used. For cord care, you'll want to keep that umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician or if you notice any drainage or discoloration. The umbilical cord will generally fall off within 2 weeks of life. Your baby should have 1 to 2 wet diapers during the first day or 2 of life, and then days 3 or 4 should have 3 fecal and 3 wet diapers. And then you should expect to have 6 to 8 wet diapers of pale urine every day after that. Over the next few days, your infant's bowel movements will begin to change from like a yellow-green to a mustard yellow and will soften in consistency. Your baby should have at least 1 bowel movement every 24 hours, so you may want to keep a record of your baby's wet and dirty diapers to monitor adequate elimination and hydration. If you had a girl baby, make sure you always wipe the baby from front to back and be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and then diaper. It's normal for baby girls to have a white or pinkish discharge, and those secretions are normal and will gradually disappear. If you had a boy baby and he is uncircumcised, still always wipe baby from front to back and be sure to cleanse all creases and folds to prevent diaper rash. Pat and dry and then diaper. If your baby is a boy and circumcised, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, pat dry, and diaper. Vaseline gauze will be applied to the circumcision with every diaper change for about 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film, which is very normal. If you see any bright red bleeding or green drainage, that's when you should contact your healthcare provider. The plastic ring method of circumcision does not require a dressing, so if that was done, keep that in mind. The ring that is used will come off usually by about 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider at that point. To cleanse the area, wipe gently with a soft cloth, cotton swab, or a gauze pad and plain water. In terms of dressing your infant in clothes, dress your baby as you would yourself. Avoid overdressing your infant though, because too much clothing and too many blankets may cause your baby to become overheated. In terms of vaccines, infants should receive all recommended vaccinations. So those are all the instructions I have for you. If you have any questions, please let me know.